This project was an evaluation of a Housing First program. A couple of organizations in our community were setting out to help chronically homeless women find home. One of the important messages that participants wanted us to hear, and they were very clear about this, was the impact of child apprehension. So we know that child apprehension is a concern for many women experiencing homelessness. But for these women, what they told us was that that particular trauma was both the root of their pathway into housing loss and continued to impede them from finding stability in their lives. We know that women who are leaving violence, if they are moved into independent living, they have a high risk for being reconnected or reconnecting with an abusive partner. And so the program needs to take into consideration a woman's choice around safety planning. Our recommendation is that any housing program working with women build in those types of skills. You should be thinking about having your staff trained in safety planning, having your staff understand the child welfare system and think about the impacts of child apprehension. So many different ways that choice comes through in this, because it could be choice of neighborhood, choice of housing, choice of living independently or together with other people. And so there's all sorts of elements of choice that are at play in this kind of very relational space between the support worker and the individual. Also think about how they identify people into the program, and that they shouldn't just be relying on those traditional pathways like folks coming through emergency shelter, but they have intentional ways of identifying women who are hidden. Housing First for women needs to be provided specifically with a consideration of gender. And so we recommend the use of a gender lens so that we can account for the unique challenges that lead women into homelessness, the challenges that keep them hidden while they're in homelessness, and also the barriers they encounter in exiting into housing.